I'm Mary Dinauer, and I am the Scientific Director of the Children's Discovery Institute. Well, it's a very tough climate right now for research funding. And any new idea, really, even before you're ready to submit a grant, takes several years of work to begin to get that preliminary data, put your ideas together, get some initial support for that concept. And even before it's ready to submit for external funding. So institutions have always relied on really other sources of money to get good ideas and great young faculty off the ground. And now with, it's been, as we know, tough economic times, and both private funding agencies as well as the National Institutes of Health have had very, very tight budgets. So it's even more competitive than it's been before to really get a successfully funded grant. So perhaps even as recently as 5 or 6 years ago, when grants were evaluated, 20% of the grants would be deemed meritorious enough to get funding. So that was sort of the threshold. Now many agencies, and the level is down to 10% or below. So that means actually a lot of great research just isn't getting funded. So people are very, when they put in a grant, they want to have all their ducks in a row. And so that takes probably another additional year of support at the institutional before grants are ready. So this is why having an organization such as the Children's Discovery Institute, I think, has been so important to our Washington University and St. Louis Children's Hospital, because prior to that, it would be very, very difficult to come up with those extra monies. And I think we help both investigators at the beginning of their career, before they have any sources of external funds, as well as established investigators that have an idea that relates to child health, want to venture into the world of pediatric research for the first time. This really allows them to get started. Not only does the Institute fund investigators, but it also provides investigators with access to really cutting-edge technologies that you really need to be, compete at the national level, really with state-of-the-art equipment, methodologies, and so forth. Another area that the CDI has been very active in is trying to help investigators establish connections between research and patients. And so we're working to develop collections of patient samples where then you can really study the actual target disease, for example, such as our brain tumor bank.